and we'll go into it again this time around. But certainly we're going to talk about other topics surrounding postpartum as well, that while they may be common, they are not considered something that you have to deal with forever. There is treatment for them, and a lot of times it's fairly straightforward. So just as a reminder or an introduction, I'm Zazu Cioce. I am a pelvic health and orthopedic physical therapist at Hudson Valley Physical Therapy.
And I'm Geri White. I am the owner and founder of Hudson Valley PT. And welcome, everyone.
So welcome. All right. So we're going to head over to our myths. Okay. So we talked a little bit about this on our trailer, but we're going to talk about it again today for everyone who did not watch that. So I leak when I laugh, but I was told, by everybody has this after having a baby. So while, right after you deliver, regardless whether that be cesarean or vaginally, because remember, even if you have a cesarean, oftentimes a cesarean is an emergency procedure. And so there is some amount of laboring that happens oftentimes prior to the cesarean. So think about, pelvic floor pressures during labor, and even pelvic floor pressures during your 9+ month pregnancy. So, leaking with laughing, it happens. It doesn't have to. So, especially right after delivery, it's, I would say it is expected that you might have some leakage right after your delivery, but you should be back to being fully continent and being able to control your urine. 6 weeks at that point, you should be in good control of your bladder. That's a good amount of time for that area to heal. Obviously, it might be plus or minus a few weeks for some people, just depending on how your labor and delivery went. And for some people, they're leak-free from after a few days after delivery. So it just kind of depends on what's going on with you. But what we're here to clear up is that it's not something you have to live with forever. Something that really kind of touches me in my heart is when I see women in their 60s or 70s with leaking urine, and I asked them when it started, and they said, oh, when I had my baby 30 years ago. And that is a disservice that really society has done to that person, because they could very well have not had this issue for the majority of their life. So that's the first myth.
And then the second myth is I don't have to touch my C-section scar afterwards. And that is incorrect, simply because if you think about it, C-section is actually a surgical scar. When they do the incision, they're actually going through 7 layers of tissue in order to get the baby out. So being a surgical scar, there is going to be healing, and it's going to be scar tissue forming. And what happens with scar tissue is then the area becomes immobile. So the abdominal wall, the abdominal muscles become really tight and constricted. And also where the location of the C-section scar is, the bladder is just below it. So then that might lead you to having issues with the bladder. So urinary frequency, urgency. You can also have pain in the C-section scar. So in terms of if you are doing any lifting and reaching, you might be feeling like a pulling sensation. That's telling you that your scar actually needs some work in terms of mobility. So yes, you definitely should be touching your C-section scar after delivery to maintain the mobility in the area, which will help with all the other things I just talked about.
Definitely. And something I, have seen also in more than one situation actually is C-section scars that really haven't been worked with, or just even, gently massaged in the general abdominal area, popping back up with issues, later on, like years later on. I've had the C-section scar mobility issues be related to knee pain. So people coming to see me with knee pain, and we do stuff for the knee doesn't really get better, but then we find out, oh, I've had a C-section, you know, however many years ago, but never really mobilized it. Oh, but yeah, it does feel tight. We work it and knee pain starts to get better. So things that maybe you wouldn't necessarily think would be connected are sometimes connected. And a lot of times that C-section incision is something that both needs work, you know, to try to loosen it up, you know, have the tissues slide and glide the way that they should over such an important area of our body, like our tummy. But also just neurologically trying to help with the sensitivity in that area and the nerves kind of regenerate and resensitize to a more normal fashion. So that's a huge one, I have to say. That's a huge one, and a huge one that I would say 9 out of 10 of the people that we see have no idea.
Right,
no
exactly.
idea.
Right. Yeah, and it could be coming in postpartum about a year, and they said, "Oh, I've never touched the scar. No one ever told me to." And yeah, you should start mobilizing it as soon as possible, actually.
Yeah, definitely. And you want to make sure that you speak with somebody before you start mobilizing it, to make sure that you're in the right healing phase. I've seen people even up to 11, 13 years
Right.
after cesarean benefiting from work there.
Right.
Okay, so let's see. I'll never have good sex again after having a baby. That is one I do see actually fairly often, which is fair because sex is an important part of our life. It's an important part of our intimate relationships. It's one way to connect with our partners and on a deeper level. And so that's important, and that's an important concern. So, you know, a lot of times we think vaginally, like if you have your baby vaginally, I hear a lot, you know, from my patients that it just feels different down there. My partner also thinks it feels different down there. What are some things? Is there anything I can do? There are things you can do. A lot of women and a lot of women kind of feel like this is their fate, and they, you know, they asked for it by having a baby, and a lot of times they get told that, to be honest, which is really terrible. But there are lots of things that you can do working with you know, a pelvic floor provider, like a physical therapist who specializes in lots of different things, but one of those things is strengthening that area to kind of help with the sensitivity and sensation in that area during sex.
Right. Exactly. And then going with that is pain with sex after baby is expected. And again, incorrect. You should not have pain no matter what delivery you've had, whether it is a natural delivery or C-section. There actually should not be pain with intercourse after delivery. If you continue to experience pain with intercourse, go back to your OBGYN just to make sure there's nothing else going on medically. And if there is, if you're cleared, then it's probably a musculoskeletal problem where the pelvic PT like us can actually help to really relieve some of the tightness or whatever might be causing your pain symptoms to help with that. But yeah, you should not be having pain with sex after delivery.
Definitely. And I'll just add a caveat to that. You should not be having pain with sex ever.
At all.
Unless that's something that you want with your sex. So I'm just going to throw that out there because I have a lot of women and men actually, who experience pain, and, you know, it's not something you really talk about. So they just think that's normal, but it's not. And there's stuff we can do to try to optimize it and help that. Okay, so then our last one on this page is going to be back pain is normal after having a baby. Okay, so after seeing many pregnant women with back pain and postpartum women with back pain, so even taking this to, you know, back pain during pregnancy, so things are changing. After you have your baby, your body is different, right? It's a very quick change. What happens is you had, you know, a certain amount of weight, a certain amount of the way that your body was used to moving, and now you had a baby and that weight is drastically different, and the way you're moving is also drastically different because you're healing in different areas. So all of that can cause sensitivity in that area, but really back pain associated with maybe like mode of delivery or just recovery from delivery, whether it be, you know, C-section or vaginal delivery, back pain specifically, should heal within a few weeks after your delivery. Yet there are still, you know, 44% of women after delivery at 1 to 2 months postpartum still having back pain. And then if you follow them even further at 6 months out and a year out, you know, a lot of them still have back pain. And so a lot of people are told, okay, yeah, you're going to have some back pain. You know, you just delivered a baby. But then they just keep waiting for it to go away. And if it isn't gone, you know, by the first, you know, 4 weeks or so, you want to go get that looked at. And sometimes it's just very easy, you know, rehab, few exercises, maybe a little bit of hands-on work to, you know, get that area optimized again so that this back pain doesn't become a chronic issue. And if you had back pain during your pregnancy, and didn't try to get it resolved during your pregnancy, you're at higher risk for having back pain that persists in postpartum. Not only that, a lot of times I will see moms that had back pain like at the end of their first pregnancy, and they're coming during their second or third pregnancy, and now the back pain started way earlier and way more intense than it did with the first pregnancy. So again, when these things start popping up, you want to address them, because you're not only just trying to kind of grit through it for right now, you actually want to solve the problem so that you don't have it for months, years afterwards.
Yeah, I agree. So yeah, so you don't want it to become chronic. So as soon as you can address it, and then you'll at least have some techniques to help manage it if it does come back. So yeah, definitely.
Definitely. All right.
Okay, so at 6 weeks, I'm good to go with my regular exercise. Maybe, but there's a couple of caveats with that. So just remember that having a baby, whether it's a C-section or a natural delivery, is a traumatic event for your body. And that it takes actually longer than you think for everything to heal. So, and if you are like an avid exercises prior to pregnancy, even during your pregnancy, I know you really want to get back to your exercise routine after your 6-week checkup. The doctor says you're fine. You really want to make sure that you get checked out, hands-on checked out by a physical therapist who can really assess where your body is at that point and to see what type of specific exercises that you're ready for. Again, they'll go through a whole body checkup, including the pelvic floor, if they're a pelvic floor therapist, to see what exercises, what activities you can start to do, and then give you more specific exercises for where your body is at that point, and then progress you from there. So you can't just say, okay, I just had a baby and I'm going to go back to my CrossFit routine. You need to make sure that your body is ready to do that.
Definitely. It's really, you know, exercise is super important, and definitely I think preaching to the choir here on the importance of exercise, just, you know, coming from our line of work. But so if anything, we're like the exercise advocates, along with our, you know, fitness friends and other fitness professionals out there. But you really want to make sure that just take a glance at what your body is even capable of right now. You know, like Geri said, birth, regardless of mode, is a trauma to your body and requires healing. So the way I think about it is, you know, if an athlete tore their ACL, we wouldn't just say, all right, cool, it's been like a month, 6 weeks, wouldn't assess their strength, wouldn't assess their coordination, wouldn't assess their ability to actually do the task that they're trying to do, whether that be CrossFit or any other type of exercise, just regular exercise at the gym, gym classes, and say, oh, okay, cool. Yeah, you should be good. Go ahead.
Right.
So if we don't do that with other, you know, other injuries to our body, why would we expect that from a a person who has gone through a trauma, a physical trauma, which is vaginal or cesarean delivery.
Right.
So kind of playing off of that, we have a lot of runners, a lot of people that love to run, and running is one of those things that, you know, it can be addictive. And so just like exercise, but I see runner's high is a thing. And so we have a lot of people who really want to get back to running, and same type of guidelines go for that. You want to see what is your body actually capable of in this specific period of time. You know, how is your recovery going? How strong are you? What's your coordination like? Can your body and your pelvis handle, you know, loaded single leg movements? Because that's what running is. It's a single leg movement. You're just hopping from one leg to another. It's very demanding for the body. And not only that, you know, it's a lot of load up and down. So, you know, there are specific return to running guidelines for people in postpartum, which is awesome. They're based off of research, and they're really made to try to help to minimize injuries, you know, if you return to running too quickly, because really injury is the biggest barrier to being able to do what you want to do. So say you are very, you know, impatient, you want to go. Okay, well, you go, but you're not prepared. You're at an increased risk for injury, just like with any other sport. And if you injure yourself, well, then that takes you out of your sport for even longer amount of time. So it's one of those things you want to think about, how can I go back so that I am increasing my longevity, so that when I go back, I can stay back and I can keep doing what I want to do, versus just being like, okay, cool, I was cleared at 6 weeks. No muscle testing, no movement screens, you know, no assessment of pain, coordination, any of that type of stuff. And, you know, you may be fine, but you also may have an injury, which then takes you off for longer than you would want to be, and then just prolongs your ability to go do what you love. So again, there are specific guidelines. So you want to be going to someone who can just give you a movement screen, a movement and strength evaluation and assessment, and just basically set you off with a plan. At least have a plan so that you can go and you can do what you want to do with a plan, versus just kind of doing it off the cuff and exposing yourself to a possible injury.
Exactly. Yeah. Okay. The next one is, this should be a happy time and transition. Absolutely, it should be a happy time. It should be a wonderful time. You just delivered a beautiful baby, and which added to your family. So yes, absolutely should be happy time and transition. However, remember what your story is. So there is a lot of expectations that society lays upon us regarding how your pregnancy should be, how delivery should be. So you see it all on social media, you see it all in the commercials, you see it all on the Hallmark made for TV movies type of thing, where everyone is so happy after delivery, which is great, but sometimes that doesn't happen. So just know that you have your story and the way you share it, and know that if your expectations for delivery was not what actually happened, that it's okay. It's okay to mourn that you went through a different road to get to your delivery, and that it's going to take some time to heal. So yeah, it's happy and it is a transition period, but also know that it's okay for you to heal. And that physical healing, mental healing, and emotional healing are all within the same realm after delivering a baby. So yeah. Anything else?
That was great. That's something I think is a soft spot for me specifically, just because I see so many women who are almost kind of like ashamed or shamed into basically being content with how things went down. You can be happy and be upset at the same time.
Yeah.
I don't know about you, but even right now with all of this quarantine stuff, I go from happy to upset, like fairly, like,
Absolutely.
quickly. And so it's okay.
Yeah.
That's gonna happen. And really, like Geri said, like staying true to your story, and your story, what makes your story so special is that it's yours. It's not supposed to be like everyone else's. And so definitely that emotional healing and processing of your birth, or maybe your pregnancy, and even during postpartum, that transition, family support, that's all super important. And we see it all the time with issues, emotional or issues being kind of held in your tissues. So that's great. Okay, so then the last one, and I see this a lot too. I had to pee a lot during my pregnancy. That's not going to change now in postpartum. Well, during your pregnancy, right, at different points during your pregnancy, you have an increased frequency to go pee for different reasons. In more of the beginning, it is more of a hormonal change that's making you go pee like so often. Towards the end, it's more of that you've got a large baby on top of your bladder that is like putting pressure on your bladder, which is then making you want to go pee all the time. So there's that. But then remember, so for a long period of time, you're kind of increasing the amount of times that you're going to pee. Well, once you're postpartum, you do still have hormone stuff going on, but you don't have like a physical pressure there on your bladder. What I tend to see happen is that people continue to go pee frequently because it is now a habit that they have created from something that is kind of like a natural phenomena during pregnancy, but it's not during postpartum. So, and it is something that can be really annoying if you're having to go pee, every hour, every half hour. I've had every 20 minutes. I've had even less than that. So having an evaluation of your bladder, of your pelvic floor, of your habits, of your nutrition is going to be able to tell us why you're still, going so often. But I will say oftentimes it is actually a habitual change that we basically trained our brain to tell us to go pee a certain amount of time, because that's the pattern that we've been in during our pregnancy and right before postpartum especially. And so we have to then untrain that pattern that our brain bladder connection has created in postpartum, but that does take work.
Right. Exactly. So yeah, so that's where we come in terms of teaching you to almost retrain, like Zazu said, your bladder and how you behave towards your bladder. So remember, you're in control of your bladder. Your bladder doesn't control you. So there's definitely a lot of tips and techniques that we can show you to do that. But yeah.
Yeah, you are. I need to make a shirt that says this. You are the boss of your bladder.
Exactly.
Not the other way around.
Exactly.
Perfect. Okay, cool. So talking about, postpartum and leaking, we are wanting to continue to serve, people who have leaking and are postpartum during this time where we are all, on stay-at-home orders. And so we've created something specifically for this problem that you can do from the comfort of your own home and kind of at your own pace too. So, which is something we've never done before. This is what happens when life changes, and we're actually really excited about it because I think a lot more people can get access to information that a lot of times, having to schlep all the way to the clinic, then, go through all these specific steps, and what a lot of times can just be very simple education and very simple coaching to fix your problem. So we're going to talk a little bit about that.
Yep, exactly. And so there you go, Leak Free After Baby Boot Camp. So it is a 2-week virtual class, 5 classes about 30 minutes long. And we posted this on our Facebook page, so it's maybe hard for you to read the exact specifics of it, but detailed information is on the event page on our Facebook page. But starting Thursday, April 30th at 7 p.m. Again, it's about a half-hour class, and then we do have additional bonuses once you sign on, where we will do a coaching call about once a week between visits, between classes if possible, to help you with wherever you are and whatever needs that you might need regarding this issue. And then to register, it is through Eventbrite. Again, all the information is on the event page of our Facebook page.
Yeah, so this course is actually filled with so much information. It's kind of insane to me. And we're bringing it at a cost point where it makes it, you know, more accessible for what you're actually getting. It makes it very accessible. Even just half of the fee of just seeing one of us one time. So we have kind of created the schedule to be more helpful for moms. So a little bit later at night and shorter class periods, so that really it's only a small chunk of time that you have to commit, but you get one-on-one coaching, which is kind of huge, which is great. So yeah, I would say, I mean, take advantage of it. But yeah, so we're offering this to anyone, everyone. It's virtual, it's coaching, it's bladder, be the boss of your bladder coaching, Leak Free After Baby Boot Camp, whatever you want to call it. But it's basically live your life with a higher quality of life and be leak free and be happy.
Exactly.
So,
and again, it's open to anyone, anywhere in the world. So if you have friends, family members who are not in the Westchester County area, but anywhere else, they can certainly hop on because it is a virtual class.
Definitely.
Yeah. Okay.
Great. So if you have any questions or anything, those are our emails. That's our physical space, which we are not in right now, but hopefully we'll be in when it is appropriate.
Yeah.
Yes. And yeah, if you have any questions about anything, please feel free to reach out to either of us. This was fun.
This was very fun, and we'll see you next Monday, same time for Myth Busting Mondays.
Yeah.
Bye.
Have a good day.
I'm just going to stop.